Scott, would you like us to get started soon, or do you want to wait for a few more minutes?
I think we can go ahead and get started, and we may have some trickle in, and we may have some come by at 5:30. But
and especially, I mean, the way I look at this is that this information is stuff that you want to be presented with, and then you want to ask again in a second. So, definitely we're going to talk about the free model, we're going to talk about how an EHR works, and at the end, I'm sure you'll come up with some questions that we can continue talking about. So anything that they missed in the first few minutes, we definitely will go over. So, yes?
I was just like, okay.
So, let's keep this, conversation. I'm glad that, we're all here today. It's kind of a small group, we can talk. But, first of all, I do kind of want to explain to you why an EHR. And this is kind of coming from my perspective on things. It's not a specific pitch I have. This is really my perspective on why an EHR. The future of it that the government's looking at, of course, is collecting the data for you to be able to allocate more resources personally to serving the patients directly. So that way, you don't have to worry as much about clerical errors, little things like that, documenting. This will be taken care of by an electronic system. Of course, that will resolve a lot of issues. Moving forward, while this data is collected by you in an organized way, you'll be more easily able to create reports. To look at the information you've collected over the years and gain knowledge from that information. Now that's where they want to go towards, of course, keeping in mind that this information is always yours. The great thing about the healthcare industry using this technology is, with security issues, there's already a lot of mandates in place. Of course, HIPAA mandates are well in place. You have to abide by them, which is, I think, of definite benefit. Now, of course, what does that mean to you today? I mean, that's great if 10 years down the road you can run a report, but why are you going to want to do it right now if you're only going to see the results later? Well, of course, right off the bat, organization in your office. It's all about allocating resources back to serving the patient, taking less time to do the charting, taking less time to manage documents, and also decentralizing that information so it's not stuck in that drawer on your desk. You have access to it. When the patient walks in the office, you're going to have a complete understanding of everything you've dealt with the patient, medication lists, diagnosis lists, past medical history, phone calls with the patient. The patient called you on the phone, but you didn't have access to a chart right there and then, so you weren't able to write it down. With an electronic health record system, you're able to log in easily, which is a few clicks, record some of that conversation to have a complete understanding of everything you guys have discussed. So right off the bat, it's almost like another personal assistant for you. It's someone to kind of take care of the more menial things so you can get back to what you want to do, which is serve the patient directly. Do the things that the electronic system cannot do. And don't think that it's going to be the kind of thing where it's going to pop up and review work and say, why are you doing this when you know better? Because at the same time, this is just a tool. It's not doing the procedures for you. It's not taking care of the visit for you. You have the knowledge. This is just a recording, organizational tool to help you take care of that. And then moving forward, again, having this access available. Now, the next question, of course, would be why a web-based EHR? Because there is a difference. There are electronic health record systems out there. The majority of them are local storage. You have to buy a server. You have to maintain and upgrade that server. You have to have an IT staff to maintain and upgrade that server. These are significant costs. These are not the upfront costs. This is part of the bottom line. You've already, let's say, with another system, paid the sign-up fee, and you've said, wow, okay, that was a lot. Then they're going to come at you with server fees. And this isn't even going directly to them. These are on the side. It's something you always want to ask when you're looking at EHRs. What is the cost of the hardware to store our requirements? With a web-based model, right off the bat, it eliminates the cost of that. It's going to make it so that you don't have to have a server in your office. You don't have to pay for any storage fees at all. But that's the cost aspect of it. The other aspect of storing your data in our secure cloud is that this is the best way to store your data, both security-wise and accessibility-wise. Security, and we will definitely get onto this with some information up there on the projection. I just want to lay some base information. But security-wise, my colleague's boss just recently pointed out to me, there's this database that the government has up where anytime medical information was compromised for a group of 500 patients or more, it has to be listed on this database. We went through it, we did some research. the vast majority of cases where the laptop or the server was stolen directly from the office. Someone literally picked it up, walked out with it. Maybe they had a tool belt on, you never know. With our secure cloud, absolutely impossible, because everything is connected by secure passwords. You're the only one who has access to this. If for some reason you leave your account logged on, within a few minutes it's going to log you off, because we don't want you walking out, getting a cup of coffee, and then someone going back. So with our secure cloud, it really is the most secure way to store your data. Accessibility-wise, again, it's not stored on your server. If something happens to that server, if it's not connected for some reason, that's not an issue, because we constantly have your data available. You log in from anywhere, any internet-ready computer,
Anywhere.
and it's there. And that includes your charts, but let's say a document, you uploaded a photograph to Practice Fusion. It's not stuck on one computer. It's accessed from any internet-ready location. So, when looking at an EHR, you really want to think about the differences out there. And we feel very strongly that the advantages of a web-based system are very apparent. It takes some getting used to looking at this information. It's very much a different way of considering your information. It's no longer something necessarily on a piece of paper, feels more tangible. But the direction that health information technology is going in is to be decentralizing this information. It's meant for access and use, and it can't be stuck in a drawer somewhere or on a particular server. So, that's kind of a brief introduction to what an EHR is, what it would mean to you, what a web-based model is. I would encourage you to also take a look at some of the videos we have. One in particular from our VP of Clinical Affairs, Matt Douglas, a brilliant guy. He does explain a web-based model, because we do feel very strongly that an EHR is not fully utilized until you get into that web-based model. We'll definitely go into that. So, we'll go ahead and get some more information here. We've all met already. Again, my name is Derek White. I'm your host. Account manager here. It's my role to just answer questions. I need to understand the industry. I need to understand the product, so that way we can have these really in-depth conversations about what this means to you. We do provide an EHR that can be used by various specialties, but you don't want to talk about how a dentist is going to use it. You want to talk about how you're going to use it in your office quickly. You want to implement this, and also how are you going to implement? We understand that the biggest obstacle out there for providers to implement an EHR are cost, as well as the cost of implementation and time. How much time are you going to have to spend reformatting your workflows to adopt this? Which is why, instead of having salespeople, we have account managers. These are people who have access to all the conversations we've recorded with you. We know what demonstrations you've attended, so that way we can get you on the next step. We know how your workflow goes. You give us a call, we'll be able to answer questions. My colleague Sebastian Rodriguez is another account manager here. We'll both be happy to talk to you, and we'll make sure you'll have our contact information today. But to get started, you asked a second ago, how is this free? This is absolutely free to practitioners. Now, when I say that, you're going to want to say, okay, a free sign-up. I can understand that, but what are maybe the other costs? What's the bottom line? The bottom line for providers is free. It's absolutely free. What that means is we don't have a sign-up fee. We don't train for support or any training that you need for you or your entire office staff. This includes anyone that you work with at your office. As well as storage and hosting fees. We will store all the data. There's no limit on how much data you can store, how many users you have in your account. So really, we are providing this service by eliminating the cost to providers. Of course, we are keeping the lights on. So we do have a diverse revenue source, very different from our competitors. I'll go into that in a second. But you're going to want to make sure that, of course, we're going to be around in 5 years. That's absolutely, what the case is really, in 5 years, we're going to be providing more functionality because of the success of our company. So, again, there is no out-of-pocket expense for you directly. It is the absolutely lowest cost of total ownership, not only because of the sign-up and support, but because of the web-based model eliminating the costs of servers and IT staff. We do provide the IT staff for you. We do not outsource our support. We do not outsource our support. We have everyone that you talk to is a Practice Fusion employee in our offices. So they have access to everyone else there, and you're going to know you're getting the really focused information. Again, as I said, we are a web-based model. Now, this is a significant advantage over our competitors. The web-based model means that all of your data is stored in our secure cloud. So it's not a matter of the server being active, being on. It's all taken care of by us. You log into Practice Fusion, you have access to all of your information right there and then. We do all of the backups for you. We redundantly back up all of the data, both in real time and later on down the road. We have redundant power systems, multiple co-locations, even armed guards, everything you can think of that Fortune 500 companies implement in their practices, to watch their data, you get to have in your own practice. Now, this is a level of security that is far beyond something that any one particular person could really implement there. I mean, they'd have to have literally multiple offices. No IT staff, again, because of the support we provide. And because of the free model, if there are any stimulus money that you would be able to qualify for, you get to keep all of that.